our original class was around like anything you need to know to advocate on behalf of yourself within the hospital system. So if you have a breech birth, if they're telling you you need to do a C-section and you don't want to, how do you deal with that in the hospital setting? What are the things you say, the right words to use? How do you kind of engage healthcare professionals so that your power isn't taken away? And that's what we kind of started with. But we realized really quickly that the parents who were coming in, they would end up in tears by the end of every session talking about harm they've experienced within the healthcare system with past births. So we realized, okay, there's something deeper going on here.
Welcome to Purposeful Empathy, a show that is dedicated to amplifying the voices of people from across the globe who understand that the world needs more empathy and are doing something about it. Today's episode is in collaboration with Ashoka Canada, a global network of leading changemakers and social entrepreneurs. Thanks for watching. Enjoy the show. So welcome to a new episode of Purposeful Empathy. Today I'm joined by Elsie Amoako, who is the founder and CEO of Mino Care, which is a social enterprise that centers the needs of birthing persons, makes it culturally safe and expertise accessible, and empowers parents through education and the removal of barriers to accessible care. She's also the founder of Mino Fest, which is a conference that's devoted to racialized reproductive and maternal health. She is an Ashoka Fellow whose journey began during her graduate research in global health and global social policy, which was actually the start of creating Mino Care in the first place. She is the recipient of many awards and millions of dollars worth of funding and has also taken part in various accelerators, including Next 36, Google's Startup Black Founders Accelerator, 1863 Ventures, and on and on. She is dedicated to solving perinatal and reproductive health disparities that disparage the Black community in Canada and globally. Welcome to the show, Elsie.
Thank you. I feel like the introduction was really great.
Well, bravo to
Kind
you.
of,
Look at
yeah,
all
I
you.
no, you kind of hyped me up when you were saying that. I was like, wait, I forgot that. So this is great. Yeah, thank you.
Well, congratulations on becoming an Ashoka Fellow. That's what brings us
Thank you.
together. I'm a big fan of social entrepreneurs, having interviewed them for my PhD many, many years ago, and realizing that they were all kind of animated by this desire to make the world a better place because they saw people who were marginalized or hurting in some way, and they felt a need to act on the empathy they felt. So that's my backstory. Let me ask about yours. Is there sort of some twists and turns, some plot twists in your life that would bring you to where we are today that I'd love to get to know you by and our listeners and viewers?
Yeah, I think like I always go back to the same kind of story. One of my siblings has sickle cell disease, and I think early on we went to Ghana. I remember when I was quite young, and when we went there, she got malaria. And I think kind of seeing the impact on the health of individuals and kind of like how the healthcare system works there and versus kind of like what we've experienced in Toronto, I always say was what kind of started or piqued my interest, I would say, in this space and just trying to understand what does health look like for people from the Black community? How are we being served in different contexts? Like, what does better care look like for us? And how can we ensure that we are getting the best possible results, right? And I think from then I started volunteering at like community health centers here, like Women's Health and Women's Hands, which is focused on racialized women, and other CHCs and hospitals, working in hospitals, all that kind of stuff. And then once I got into school, graduate school, like university graduate school, I really focused like the end of my undergrad and most of my graduate education on research, really, focusing a lot on qualitative and quantitative and mixed methods research and just trying to figure out like, can I learn better? I was very global health focused first. I went to work in Ghana for half a second. But then I kind of realized like I got into a PhD program at U of T and I was just kind of like, you know what? I think I really want to focus on maternal health, like Black maternal health specifically, whether it's a global context or a Canadian context, like I just want to understand what's happening. And as I learned more, specifically after my master's, as I learned more about what the health outcomes looked like for Black birthing persons in like North America and like Europe as well, I was like, we have like the whole idea of global is local kind of kicked in. And I was like, we really need to focus on the people here and what they're dealing with before we can go anywhere else. So that was kind of like where my interest in this space really started to be created and how I've kind of it's the beginning of my journey before I kind of started Mino Care.
I think, I mean, so I'm a mom now. My daughter's turning 8, and I decided to go the route of wanting to have her in a birthing center and learning
Hmm.
about sort of how mechanistic our healthcare system has become. And so,
Hmm.
out of tandem with what we know intuitively and through the dawn of time. But I think it was Serena Williams who had some healthcare issues surrounding
Hmm.
her pregnancy that put into the forefront for the public, the general public, the health disparities between racialized birthing people and white. So could you maybe just share a few stats to sort of give us a sense of like what this problem really is about?
Yeah, for sure. So the Serena Williams example is a great example because it kind of brought to context the fact that like education, social economic status, like all the things that you think can help you during pregnancy and when you're engaging the healthcare system really doesn't matter when you're a Black woman, unfortunately, specifically in the United States, in Canada as well, though we don't have data to kind of prove a lot of it. But and even in the UK, we're seeing a large significant or many similarities as well, right? And what it comes down to is that the research, unfortunately, there's nothing like in terms of physiology where we can say that this is the reason why this is happening. There's no specifics in research that we've seen thus far. But the one thing we do know consistently is that the issue stems directly from the experience that individuals are happening and the historical kind of the way education was developed in medicine and the ideas around who Black folks are and like these stereotypes created about us, like things like Black people don't feel pain, or Black people are more likely to be or more susceptible to becoming addicted to painkillers, so don't give them any when they're in the hospital. Or more like recently, we've heard a lot of like in hospitals, them not encouraging Black mothers to breastfeed and rather forcing formula on them in hospitals. So like, or that Black dads are kicked out of the room when the Black moms are birthing. Like it's consistent with what we've seen throughout history. And a lot of it, like it's a lot in terms of like breaking down like why we think all these things are happening, but a lot of it is historical, right? And if we look all the way back to like when slavery started, right? Specifically United States, even in Canada, very early on, Black men were used to just kind of breed. They were used literally like horses to just breed children, right? With other slave women so that they would have enough slaves to work on their fields. And so the Black family was ripped apart really early on. And we see that significantly over time, even like within the 80s, right? In the crack epidemic, right? United States, where we saw a lot of Black mothers who were put in jail. And when they were in jail and they found out they were pregnant, that they threatened to kill their babies, right? Like there's just like consistently we're seeing the same thing where Black women are being promised things if they're not birthing, or they're being positioned in a place where they can't have a full family. It's the social economic, like the social determinants of health and social factors and how that impacts their general experience. I think the underlying thing is racism. People will say it's race. It's not that we're Black, it's that we're experiencing racism, right? Racism within the healthcare system, racism within various spaces, and the way people see us and how they what they think of us also turns or impacts the way we receive care, right? Which also leads into how we personally as individuals, how we adhere to care, right? Whether or not we trust the system, whether or not we trust the healthcare professionals who are serving us. And then again, that leads to a lack of education because now that we're not trusting the system, we're not fully aware of what's available to us or what's accessible to us. And it becomes more of a communal thing where we're only trusting what our friend says and what people say around us. And unfortunately, that is not always evidence-based, right? And that's not always information that can really help people. So I think that is the key for me from what I've seen consistently. It seems like it comes from all that. So lack of policies, a lack of research is the biggest one in Canada. We don't even have any segregated data, right? We don't know how many Black women give birth annually. So how can we know what their experiences look like and their complications and what that looks like, right? A lot of the information we get as an organization is direct from healthcare professionals who tell us the NICU is full of Black infants, right? Which tells us specifically that the Black mothers obviously are having, or Black birthing persons are also having complications during birth. So it's just, it's consistent with how our systems are built, our governments are built, and what people really care about, and also what the community is willing to do as far as coming together to ensure that there's a change. So yeah.
And we do know statistically that there are disparities, right?
100%. Yeah. So that's US based data, but we use it to mirror here as well. So in the UK, I think it's like up to 5 times worse than their white counterparts. In the USA, it's 3 to 4 times worse than their white counterparts, that they're experiencing complications that can lead to life-threatening. They're experiencing maternal morbidity and mortality, and they're experiencing complications that are much worse than their white counterparts, right? We're seeing the same thing for infants, Black infants that are being birthed, right? Having the same, I think they're also 3 times more likely to have health issues as well when they're born in comparison to other white infants. So the point I'm trying to make is that consistently we're seeing research, but in Canada, we don't have anything that says these are our stats. We're very much using and mirroring other countries.
So is that a gap that Mino Care is trying to fill as well? Okay, so let's start with
Yeah,
the story of, okay, this is a reality, and I think there's a problem, a set of problems that need to
yeah.
be overcome. How is Mino Care addressing that? What's your theory of change? What's your big mission, vision, and yeah, how are you working to solve this?
Yeah, so Mino Care originally was Mommy Monitor, and I was created right after my master's. So I did a research study like everybody else does, and kind of had my recommendations and all that kind of good stuff. And I remember I waited about a year after, and was just would every now and then I would look up the new academic papers, just seeing what else anybody else is doing in this space. And I was noticing nothing was really happening, and there was no change. And I was looking at some social scientists and the work they were doing, and they consistently were saying, well, with that African Caribbean, Latin American community that's coming into Canada, these are their birth outcomes. And it was quite similar to what we're seeing in the US for those who are Black or racial, well, Black specifically. So a part of me was like, this is great research, but it doesn't take into account the full scope of the Canadian experience, right? We're not understanding Canadians who were born in Canada and the difference between them and immigrants, refugees and their experience. We're also not looking at Canadians who don't come from a refugee or immigrant kind of household, who are Canadians that kind of immigrated here from the US during slavery and have been here ever since. Like these are all varied experiences, although we're all Black people. So for me, and let's not even get like ethnicity into it, because because those from the Caribbean and those from the continent of Africa and Afro Arabs, Afro Latinas, like Afro Latinos, like we are all quite different in our practices, although we're quite similar, right? So for me, a lot of it early on was trying to figure out how can we understand contextually what everybody is experiencing, at least at a ground level, and provide them with supports that ensure that they all have consistent care that is accessible, that is provided with ease, and ensures that they have the best possible health outcomes. So really early on after my research is when I started to kind of pitch and try to figure out like, can I get a little money to just start something, maybe figure things out? So I started pitching early on. I won some pitch competitions, got some funding, and it kind of helped me to kind of start. Really early on, we were focused on an app. I realized really quickly that like I don't even know what I'm building. So like we went right into R&D and like market research, and we started these birth justice workshops. So that was the beginning of us, right?
Birth justice workshops. Okay,
Yes,
take a
exactly.
second. Can you tell me what that's like? What's a
100%.
yeah.
Yeah. So the birth justice workshop for us is a workshop where we had a midwife facilitate, and we have like 13, we probably have over 20 really set up sessions where we talk about different topics. So our original class was around like anything you need to know to advocate on behalf of yourself within the hospital system. So if you have a breech birth, if they're telling you you need to do a C-section and you don't want to, how do you deal with that in the hospital setting? What are the things you say, the right words to use? How do you kind of engage healthcare professionals so that your power isn't taken away? And that's what we kind of started with. But we realized really quickly that the parents who were coming in, they would end up in tears by the end of every session talking about harm they've experienced within the healthcare system with past births. So we realized, okay, there's something deeper going on here. People don't just need like an app or whatever. They need a lot more. So we have to better understand how to serve them. So we continued that on for a few years. And then we realized while engaging our health professional network that people are like, we want to convene as well. Like we want to talk. So that's how the conference started. So we actually started with birth justice workshops and the conference. And the conference was quite successful. The first year, I remember we had like over 300 people, and it was really great. Health professionals flew in from all over to Toronto to come in and just kind of hear about what we're doing, hear about the latest research, the latest kind of programming, like what people are doing here from all racialized communities. So it was really beautiful. But then as time went by, we started to realize, okay, what people need is we first started with like doula care. But then as time went by, and now we're towards like COVID, and we're realizing no, it's more than that. We need wraparound support. We need a full circle of care. So what that looks like for us is connecting the social with the clinical and involving the family as well. And that means you're provided a variety op an option to access a variety of services, which could be anything from pelvic floor therapy to doula support, mental health support, pregnancy massage, social services, help finding a midwife. Like you literally name it and we do it. At this point, childcare, all of the above, respite care for moms who are single and need someone to take care of their child while they're giving birth in the hospital. Like you name it, like we learned our community and we learned what is needed. And then that's when we started kind of accessing all those services. And we were like, really early on, consistently, we're like, we have to be culturally safe. We started off saying we want to be culturally sensitive, but as I learned and grew, I was like, it's not about being sensitive because we don't need, and we don't want to be competent because that's ridiculous. What we're doing is creating a safe space for different individuals and their cultures and their ideals and what they need as individuals. What we're trying to do is create a space where we can customize care for each individual who comes into Mino Care. So that is what we do now. We are like a virtual community health center that focuses on perinatal and reproductive care services. And we focus on customizing care to each person who enters in. So you come in, you do an assessment, you may come in saying you only want doula care, but then we say, you know what, after talking to our experts, you actually may need some mental health support, or you actually may need a pelvic floor therapist. What do you think? And if the person agrees, we also connect them to those services. As they're seeing the professionals that we connect them with, the professionals also send us status updates. And the professionals, the doula will say, you know what? This patient is really dealing with some housing issues, or this patient is really dealing with like some discomfort. And I think it would be really great if they had a pregnancy massage. Like, and then we're like, okay, cool. We go back to the client again. Would you like this service? We were told that it may be beneficial. The person will say yes or no. And then we continue to serve them. And each client we deal with for a year plus, depending. Like long term, most clients to stay on board just for mental health support. But for the most part, we deal with them for over a year. And we engage them in every possible way to ensure that, and we follow up consistently just so that they know somebody's there. And at the end now we realized like, and this is when Mommy Monitor became Mino Care, which was about a year ago. We rebranded. And then Mino means our mothers. And it's from the now it's modern day Benin. But it used to be the Dahomey Kingdom. And I don't know if I always tell people like the easiest example I can think of is like Black Panther or like Woman King, like those warriors who were fighting, the women. That was their name. They were the Ogoji warriors, or they were also called the Mino. And many of them didn't birth, right? But they were
Like
seen
doing
as
this, I feel like doing this power pose.
Stop.
Got it.
No, it's true though, because that's what it makes. I realized it really late on. This is what who we are. They were advocates for their community. They protected them. They loved on them. And when they would walk into the village after a war that they've won, people would scream their names. They would scream Mino because they're like that. Those are our mothers, right? And I realized that's who we are. I was like, we were people's advocates. We're people's access to care. We're all these things, and we do it, and it doesn't matter whether people are birthing or not birthing, whether whatever their gender is, like all their sexual, like all those things don't matter anymore, right? Other than when we're trying to customize care to people to give them everything they need. What matters is that we're recognizing that we want to be that extra support for you. We want to be consistent with you, and we want to be that thing that removes the barrier that people have with healthcare now. So we directly will engage healthcare systems and all that stuff, and they refer their patients to us, and then we serve their patients, and it just makes care a lot more effective that way.
Wow. Okay. All right. I can see why you've won some pitch competitions. That passion
Oh,
right through.
you're
So
funny.
I'm sensing, there's probably many ways that you can quantify the impact that you've had, but I wonder, what is something that you hear from your birthing persons or the people who have used your services? Like, what is this a refrain that you keep hearing over and over in terms of how different their outcome was if they'd had a child before, or based on what their expectation was? And what are you hearing? What are you hearing
I
as you?
always use the example. There's two examples that I love.
Uh-huh.
So one of them just kind of speaks to the cultural safety bit and how important it is. So there was one of our midwives was in hospital and a client was there, and that client had was Rastafari and she had dreads. And so the doctor, she had really low nutrition, she had all these like low iron, like she had a bunch of things going on, right? And the doctors didn't know what was going on, and they're just like, you're pregnant, this can't be happening, this is dangerous. And our midwife who works with us saw her and immediately was like, oh, she's Rastafari, she's from this sect, and they eat like this, which is why, and she knew all this just from looking at her hair, and which is why she's experiencing the type of nutrition outcomes that she has right now, and why it's impacting her body and her pregnancy. We just need to change it to this because this is within the range of what they can eat. And when as soon as they told the woman, she changed her eating habits and everything was fine. Like to me, that's a perfect example to me of why culturally safe care matters,
Mhm.
because all it takes is having the right people and spaces to just identify things. Like I always say, like doctors and nurses and all the healthcare professionals out there who are like non-Black or just not from certain cultures or ethnicities, they're not going to know everything about everybody's culture. It's impossible,
Right.
right? But what we can do as a society is just put a lot more people from different cultures in that space so that they can identify these things. And that's what helps people to have better care experiences. The other example I have is the first client we ever had. And that client was like our pilot. And I remember I was really nervous. It's just kind of like, all right, let's see what happens here. But it was a young woman and she had multiple fibroids and she had difficulty carrying. She had miscarried before on more than one occasion. And she was a young woman. And she was just like, I don't know what I need, but I just don't want to lose this baby, right? And we were just kind of like, okay, let's just figure out how we can build a really strong care team around her to support her. So she had her regular physician, but then or her OB, and then we connected her also with a midwife to kind of help further. And but in addition to that, we also connected her with two doulas. So the reason why we connected her with two doulas is because she was doing surgery and she needed support for a little longer and she needed kind of extra care. So we just wanted to make sure she was super supported throughout the pregnancy, the labor, and the postpartum period, and the surgery after postpartum. So she got the support that she needed. What was funny is what made her come to us is her doctor told her that she was going to have a hysterectomy, that she would lose her child, and she would never be able to have another child again. So we were like, okay, let's just figure this out. We talked to some of our healthcare professionals. They're like, that's not the only option. And we are like, okay, great. So we had her speak to them. We were very involved in like her health, her checkups, everything, following up, just making sure she was okay. And like a year later, she gave birth to a beautiful little boy. And she took out the larger fibroids that were impacting her, and she did the surgery and she was supported throughout all of that. And to this day, she sends us baby pictures and she's just like, if it wasn't for you guys, I don't know where I would have been. I wouldn't have had a child. I wouldn't have had anything, right? And pretty consistently, what we've heard from all patients and clients who work with us is that it's the difference between life and death for them. A lot of them are in a situation where they're either experiencing harm, they're being treated really poorly for various reasons. Sometimes it's language barriers, sometimes it's just lack of understanding, lack of education. It's a million different things. Sometimes it's just blatantly racism. But what they found is having our support through our professionals always helps them to figure out, like to feel more comfortable and also to just feel more empowered, right? And to know that they have an advocate with them. They have their families now informed, they're informed, they know they can access us for more services if they need to. They don't have to be afraid to do it and they can trust us, which is bigger than what they can experience with anybody else. So that's always been like, for me, these are the things that made me realize like, oh wow, like what we're doing is actually working. Like I said, we said we were going to customize care, like we said we were going to do this, but like we're really doing it.
Wow. So back in the day when you were doing your research, you kind of, I guess, you had an idea of what could be helpful. You tested it out. Things have grown. The conference. Where do you envision Mino Care in 5 or 10 years? What's the big vision that you can see that you're working towards?
I always use like examples that are like easy for people to understand. I look at like Maven Clinic, for example, or like City Block Health that are based out of the US. And like they, for example, do virtual care, but they also have hubs in all the communities, which is what I'd like to do ideally. But then in addition to that, having the ability to like there's more. Okay, wait, I don't want to say too much, but there's more. There's more that we want to do. We want to look at insurance in the future. We want to look at being in the corporate space and providing being a part of benefit packages for different corporations for moms and like families who need support and services. Because there's not much, like we're the only people in Canada doing what we're doing as far as focusing on racialized folks, but just generally in terms of providing a variety of services, we're one of the few. There's some organizations doing it as well. And then I think as well, in addition to that, long-term opening postpartum houses that are focused to what we're doing. I've been for years doing a lot of research focused around postpartum health. And I know it's one of the most important times, that fourth phase, where it's a make or break that year after birth. Like a lot of people can still unfortunately die if they're not being taken care of like appropriately. And even up to 10 years after that, people can experience cardiovascular issues and other kind of illnesses because they weren't taken care of properly during their postpartum phase or during their labor, right? So for me, it's just realizing people need someone to take care of them, and we need to create space to do that. So that's what I'm hoping to do in Canada. We are also looking at research. We're now moving into the research and policy space. Like I said before, it's limited data here. So a lot of the work we're trying to do now is trying to collect that data. We've done a lot of small studies just to help us to run as a company. But now we're kind of moving towards like a national type of study where we just want to try to figure out everyone's, all Black women and Black birthing persons, their maternal health experiences over the past 10 years. So that's something we're working on now. And then from there, hopefully we can move into policy where we try to kind of push the government to pay attention to maternal health policies, because we don't have a ministry for maternal health. We don't have any maternal health focused policies or reproductive health policies. Some reproductive now. There's a few recently that they've been pushed to kind of push forward, but nothing really for maternal health. So I think that our next goal is to move into that space and truly push for free doula care that's covered by our government. But then in addition to that, free pelvic floor therapy, because now those are private services. So that's kind of like where we're going as far as those. And then hopefully as time goes on, we can move into the global space as well, specifically within the continent of Africa, Caribbean. There's a few spaces there, and the UK specifically. There's a few spaces there that we've been really looking into, specifically like London, where we know that, like I actually just saw today a stat that Black women there have the highest numbers of perinatal, like what should we call it, postpartum depression in comparison to any other group, right? Worse than any other group. We already know their stats are very similar to ours already here. So it's really sad. And I see there's some groups trying to get together there and do some work, but I would love to help out there, especially because our healthcare systems are so similar. And Ghana, we've been looking at as well, starting to figure out how we can collect some data there, creating partnerships with some of the postpartum houses there and people doing work there to see how our services can fit in that system. And the Caribbean, we've been looking at Barbados, who we've been talking to people there and just try again, just kind of get an idea of like the of the like the scope of the entire country and their maternal health perinatal care services and just how we can fit and what we can do to support. So that's like a little longer down the road, but there's a lot that we want to do and we're working on it really consistently. And a lot of people ask, how are you going to do it all? And I don't know, but we're doing it. It's working. So I'm not going to stop.
I'm just amazed how many hours do you sleep, Elsie?
Very little, very little.
So let me ask you a question then, because I see where your work fits into the United Nations SDGs. You definitely click a few boxes there. I recently came across some work on the inner development goals, because the idea is that, 6 years out from 2030, the globe has achieved 12% of the goals that it set forth for itself. And so the idea is, holy smokes, we're never going to achieve these outer impact goals unless we actually, are the kind of leaders that are going to, push for it to happen. Clearly, you are one of those leaders. I'm curious to know if you know of the framework and if there's any skill in particular from the 23 that are part of that framework that you think really helps you in your work.
So what I found in global health is that there is consistently this lack in terms of lack of communication. There will be like 5 different organizations who are in one space doing the exact same thing. So they're all working on HIV care in the same village or working on wells, developing wells, whatever, in the same village. Nobody's communicating and nobody's building partnerships and nobody is doing anything that's sustainable. They're all building things where they leave quite quickly, and the people in the village don't actually know how to use what they've created, and it becomes a waste, right? So that's always been the example for me very early on during my master's when I was starting this work. And I realized that like those are the things we don't want to be. So that is for me has been the thing that has kind of helped guide how we function as an organization. The focus has always been sustainability long term. How can we create something where the people can take control of it later on, and where it's not an Elsie thing and it's something that can be consistently kind of like grow and kind of scale on its own, really without the need for just me more than anything else. So sustainability has been huge for me more than anything else. Effectiveness and efficiency has been another huge thing that we've kind of looked at consistently, how we're using technology and how that can be allow us to be more effective and efficient in what we're doing. The other piece has always been more than anything else for us to kind of realize or recognize partnerships and, like you said, collaborations. What does that look for like for us? For us, they're intersectoral, they're intergovernmental, they're in community. And what we have to do a lot of the time is, for us specifically, is identify how they kind of streamline within each other, or how they're connected, and how that impacts our organization and how we function. And that model in itself is super intense sometimes in trying to figure out how all these partners, because everybody has their own agendas, right? So understanding how to work with everyone has been really interesting, and how to get away from kind of like the red tape and bureaucracies that are connected to hospitals and other kind of in the government and all those kind of things, right? So for me, those are the main things more than anything else.
Two more questions, Elsie, and thank you so much for spending part of your afternoon sharing the important work that you're doing. Question on behalf of Ashoka is how has it been as a fellow? How has that impacted your work at all?
No, it's amazing. I always say that the moment I became, the interview was a lot. It was a long process. It was a very long process. That was very intense. I remember, I think it was a week long. It feels like a week. I don't even know at this point. But I just remember being like, wow, like what is this, these people that I'm like, this has to be worth it because this is intense. And all the questions that you're being asked, it made you really think about yourself. And one thing I can say I truly appreciate is even within that process of like being just chosen for an interview, and doing the actual interview and working with one of the, I think the program managers or whomever throughout that time, it's like I learned a lot about myself and my organization because I literally sat down with someone and broke down like things like the theory of change and like all the things like my goal for the next 5 to 10 years. Like I felt like I knew these things, but after having more really in-depth conversations and kind of hearing them tell me back what I've told them, it made me realize who we really were, which was really amazing. But outside of all of that, I just, from the moment I became a fellow, the first thing that happened is they opened doors for us to get more funding immediately. But I got like a phone call from some random funder, like, oh, we heard about you from a fellow and we want to like fund you guys. I was like, what? So like that was the first interaction we had like immediately. Like I'm talking like a weekend or something, right? And from there, it's been consistently the same thing, just like doors opening, me being able to kind of connect with the West African fellows and like people all the French fellows, like people all over the world. And it's been really beautiful because I've had the opportunity to learn about like community health centers and healthcare systems and maternal health in other countries and really continue to learn and grow while we're here as well. So I just love them. It's been nothing but positive with them. It continues to be positive. And I'm really, really grateful to have them be a part of like my life.
Well, that's wonderful to hear because I'm a big fan of the organization, all the way back to Bill Drayton and his origin story and all of that. So I'm happy to hear that. My last question for you is something I asked of all the podcast guests that I've had over the last couple of years. The podcast is devoted to purposeful empathy, right? So, showing empathy on purpose. I wonder if you have a story from your own personal life of when you were on the receiving end of empathy and what that meant for you.
Yeah, I think so. What I love, so story I'm going to tell you about is about our conference, and it was actually about the first year we did it. And I struggled a lot that first year because I was trying to do this conference, and I didn't know how to. Like, let's just put it that way. I didn't know how to. I was learning on the whim, right? And I had invited all these really extraordinary speakers from all over Canada who were really well known and really amazing. And I was trying to build a website using Fiverr. And I kind of was just kind of like in a space of like, I don't know how to build this. I don't know what should be on it. And I remember while we were building the website, the person launched it early and he wasn't supposed to. And so the speakers, like on the posters or whatever, the website was there, but the website wasn't meant to be available until I had 100% confirmed and signed contract with every speaker, right? And one of the speakers found out that it was available and emailed all the other speakers and said, look at what she's done. And she's using us. She's a horrible person. Don't trust her. You shouldn't even speak at this conference. Like it was really bad. And I had no idea anything was going on. I was literally just trying to plan it. I didn't know what was going on. I didn't know the website was available to anyone. And then the person who sent the email to everyone emailed me directly after and said, hey, like, did you know the website was up? Did you do that on purpose? And I was like, oh no, of course not. I was like, I didn't even know it was up. Like, let me take that down immediately. And I spoke to the fiber person, and the guy also put the website down. But then right after that, immediately, that person never talked to me again. But then all the other speakers began to email me. And they started to ask me all these questions. And it became a situation where it was very much like I was this horrible person. And I couldn't understand why. And I was in my mind, I was like, I'm not making money off of this. I'm not like, there's nothing I'm really gaining other than losing time and effort. So I had to like do a group email to all the speakers, even those who weren't involved, and kind of tell them everything that happened, just so because I was tired of the gossiping. So I did that to try to be super transparent, super accountable, apologize, told them that like I'm really sorry that this happened. It will not happen again. I can like assure you all that like this was not meant to be a situation where I was trying to benefit off of you. I was trying to do anything before your permission. Clearly, a lot of us are still in the talking stage of trying to figure out whether or not you're going to speak at the conference. So I just want to make sure you understand that. Some people dropped out, some people stayed, and that was okay. But after all of that happened and the conference happened and it was over, the conference was beautiful. People really loved it. It was a beautiful, beautiful day. I remember it was a snowstorm as well, and people still came. It was really amazing. And I remember at the end of that, one of the speakers came up to me and she said, I want to apologize. And I was like, why? And she was like, well, this is what actually happened behind the door, that you didn't realize. This person actually reached out to all of us individually and told us that you were going out of your way to kind of make money off of this, that we all needed to be careful, that you were a thief and you were this horrible person. And I've come here today and I've seen you and I've realized how wrong they are. And I apologize. And I was like in shock. I was like, did this really happen? And I was like thinking to this person, I was like, she really thinks this of me. And to me, that empathy moment was her coming and telling me the truth. And I realized in that moment, it's not a me thing. It really wasn't a me thing. It was like people who honestly were not happy about me trying to build something realistically. And it's unfortunate, but at least from that, I got an amazing ally and friend and
Mhm.
a person who was like, listen, now when I call her, she's like, anything you need. She actually became a part of our board even for the conference later on. So it's like, for me, it's like, for me, that was a beautiful moment where somebody truly saw me and genuinely realized that I'm here not to gain, but to just do something I love and to hopefully help people and to educate people. I always say I'm here to serve. So like for me, that was one of the like most beautiful, like kind of empathetic moments that I kind of had like in this workspace. And I also realized how cutthroat people can be and how you have to be super careful. Like that was the other thing I learned. I was like, I'm not playing with these people. And so now I'm just like I stay far away from the lady who started kind of like all the drama. Like I know her now. I'm like, yeah, no. And the other lady, it's funny because the other one who was a part of it now still kind of reaches out to me and asks me to like help her do things. I'm like, no, absolutely not. And it's interesting because I consistently get asked, like, why don't you invite this person to come speak at the conference? It's weird. I'm like, well, if only you knew. Like, if only you knew. Yeah, no, I don't want anyone involved. I'm good. I don't want anyone negative like around me. But yeah, but that was a beautiful moment for me.
I bet. I feel tenderhearted about that. I'm so glad she did have the kindness to share and to offer the apology that I think you might not even had known was needed. You know what I mean? Like, you wrote your apology note, which I think
Yeah.
took a big person to do, and you fixed what needed to be fixed. Some people left the conference, as you said, and others stuck around. I'm so happy that you had the inner fortitude to keep doing that, but I'm really happy that happened for you. And I'm glad you got the validation that you deserve, that you're doing. I mean, I can tell, right? Like, we're chatting here. You've got other things to do. You're building an empire for maternal health. And I'm just grateful that you had that. Thank you for sharing that. Thank you for making the time to share your passion, and the important work that Mino Care is doing. I wish you all the best.
Thank you. I appreciate it. And I appreciate being here, and I appreciate.
Thank you for watching. Thank you for listening. We'll see you next time at Purposeful Empathy. I want to extend a special thanks to Ashoka Canada for their support. Ashoka Canada is dedicated to fostering social innovation and supporting Canada's highest impact social entrepreneurs. Thanks so much for watching. Hope you'll hit the subscribe button, and we'll see you next week at Purposeful Empathy.